Hello, I'm Dr. David Cathcart. I'm a family practice physician from Heartland Regional Medical Center in St. Joseph, and we're going to talk about chemotherapy drugs and their side effects today.
There are various types of chemotherapy agents that are around, and most of the chemotherapy agents interfere with the cell's ability to divide. Now, they're classified in various different ways. There are what's called alkylating agents, and if you're a history buff, of course, you probably remember the infamous mustard gas from World War I, which is actually the alkylating agents, or one of the types of alkylating agents that is used in cancer chemotherapy. There's another class called platnin drugs, and the platnin drugs and the alkylating agents act almost in the same way by killing off the genetic material inside the cell, essentially the DNA, and by killing that off, it interferes with that cell's ability to replicate itself, so it tends to die off. An example of a platinum drug would be a drug called cisplatin. There are other types of chemotherapy agents that interfere with the cell's ability to replicate DNA by interfering with enzymes. And these enzymes, when a cell starts to divide, for example, one of those enzymes will help the RNA strands to unpair, and if they can't unpair, they can't be copied by the RNA, which would allow the cell to make a new cell. Ultimately, there are multiple types of chemotherapy. We talked about those that primarily interfere with the cell's ability to divide, although there are some other kinds as well. There are agents that are used to trick the immune system into believing that cancer cells are foreign, and so those agents then allow the immune system to attack those cancer cells. Those can be considered chemotherapy agents. And there are other agents that tend to restrict the flow of blood, the nutrient flow of blood to those tumor cells that keep them alive. So there's various types of chemotherapeutic agents. The most common ones are those that interfere with the cell's ability to divide. This is Dr. Cathcart talking to you about the various types of chemotherapy.